Very much for the introduction. Welcome everyone. My name is Maxime Lê, and today, well, we're going to talk about patient engagement and why this is imperative and important for research, healthcare, and ourselves. So on this slide here, we can see the presentation outline. We're going to talk a bit about me and my experience as a patient advisor and advocate. We're going to look at the differences, provide a case example, talk about my concrete experience, and share a bit of cancer patient experiences. And then we're going to go into the implication part. And we're going to end with a few resources, the contact info, and Q&A. Cette présentation, malheureusement, aujourd'hui est seulement en anglais. This presentation today is only in English for the time being. Mais il y aura une version francophone de la présentation disponible par après. So there will be a French version of the presentation that'll be available, afterwards upon request. So a bit about me. Well, my name is Max, as you can already tell. I have obtained my bachelor's degree of health sciences at the University of Ottawa in April of 2018, and I'm just now starting my master's of communications also at the University of Ottawa, and I'm set to hopefully graduate for this in 2020. I have had some experience in both the advisory and advocacy piece. Today I'm here to talk as a patient advisor at the Ottawa Hospital, but I also have been a patient advocate by being a spokesperson for Freeze the Industry, which is like a youth-led anti-tobacco group. And some of my peers and colleagues consider me like a community leader for the University of Ottawa Heart Institute and the mental health services on and off campus. Formerly, I have been employed at the Pinecrest Queensway Community Health Centre, and I'm currently employed at Ottawa Public Health, and I'm a freelance consultant for public and private groups. So it's important to make a difference between advisory and advocacy, because sometimes the difference might not be that evident. So on the left side of your screen, you can see the advisory piece. So patient advisors are more like partners and offer advice. That is what advisory is to offer advice on anything that affects their care. They don't usually work directly with patients and are often volunteers with local community hospitals. Now, in contrast with the advocacy piece, on the right side, where patients play an interactive and active role in representing their homologs and protecting the rights of patients. They also tend to work directly with patients in engaging them one-on-one, and are usually organized into associations, foundations, councils, etc., just like the CCSN. On the bottom of the screen, there's I made like sort of like this sliding scale, and we'll see in the following slides some case examples, and we'll see, according to the actions that patients do, where on the scale these patients would fit. So let's move on to that. So the case example. Let's say a hospital does not yet have a policy that establishes smoking boundaries for smokers. Sounds good. Patients want to get involved. Patients want to do things. So the first action a patient does, they would, let's say, a patient with lung cancer, they create and share a petition in favor of the policy and then presents this petition to the hospital's operating board. Well, in that case, this patient acts more like a patient advocate, and they would fall on the advocate side of the scale. If a patient either chooses to review and comments on the literature and signage that will inform hospital goers of the incoming change, well, then they are advising. So they would fall on the advisory side of the scale. And finally, neutral patients in the middle that get to enjoy a cleaner airspace while recovering from lung cancer, well, they're not necessarily advisors or advocates. They fall right in the middle. They are simply patients that benefit from the work of both of these groups. So I hope the difference is clear and evident. If it's not, you can always ask me some questions following up, and we'll talk about that a bit later. I have had the opportunity to be in all three roles, and as a patient advocate, it's not only at the hospital that I can advocate. I can advocate anywhere else. I can advocate in municipalities, provincial or federal governments, and that's what I've done. So as a patient advocate, I have testified before the House of Commons' Standing Committee for Health to help approve and pass Bill S5. Now, Bill S5, essentially what it does, it regulates plain and standardized tobacco packaging that protects potential youth smokers from the effects of tobacco marketing. I was there as a patient advocate and as a spokesperson for Freeze the Industry, which I've mentioned a bit about that in the beginning, but essentially it is a youth-led coalition that fights back against big tobacco, and we've worked alongside folks from the Canadian Cancer Society, which of course comprises of those patient advocate and patient advisory groups. So you can find a bit of both practically anywhere. Specifically, my advisor with the Ottawa Hospital is from the Patient Advocate Program and Patient Engagement Program at the Ottawa Hospital. The program is brand new, it's 1 year old, and includes 140 volunteer patient advisors which contribute to the Ottawa Hospital. And there are usually 5 areas of focus where patient advisors can sort of engage in. So that's sort of like staff education and training, patient and family educational material, engagement in clinical and non-clinical processes, research, and engaging in decision making related to strategic direction, which ultimately impacts clinical care. So the way this kind of works is that managers get to know the interests of fellow advisors, and then they introduce them to teams that are looking to engage patients. Then there's a call to action, and should you want to volunteer your time for this sort of project, you accept and get started. On this panel with me, and we've mentioned it before, but there is Claudia, who is the patient engagement coordinator over at the Ottawa Hospital. So I invite you all in the chat to say hi to Claudia, even though you cannot speak. Just say hi in the chat or in your head. So hello, Claudia. Would you like to speak a bit to this program?
Hi, thank you so much, Max, and thank you everyone who's participating. It's a great new program here at the Ottawa Hospital where we out of the PFACs that we're running here for the past few years, we developed a more comprehensive patient advisory program. Patient advisors here at the Ottawa Hospital are involved in, as staffs, as Max said, in these 5 areas of focus. They're doing things like supporting our new patient education project. They're assisting us with reviewing documents, patient information documents. We consult them when we have a change in the hospital or we need to review materials. And they've even been involved in strategic direction planning. We also have patient advisors on multiple committees in the hospital. And like Max said, they're not really having direct patient care or contact. They become partners with the Ottawa Hospital. They partner with us to improve services and patient experience here at the hospital. And that includes improvement in quality and processes.
Thank you very much.
Thank you.
For this wonderful introduction to what being a patient advisor is. So essentially, if we just change slides, what the Ottawa Hospital is trying to do is to do patient engagement. So what is that exactly? Well, it is the meaningful and active collaboration of patients in research, in governance, priority setting, conduct, and knowledge translation. I've had the opportunity to borrow this lovely slide that Claudia and her colleague had made, and basically this continuum of patient engagement. Patient advisors can do any of all of these things. They can inform by by completing surveys. They can consult by creating focus groups on certain topics. They could get involved by creating committees for a specific issue, or they could, collaborate on designing sort of projects and research that it needs to be done. And they can get empowered by co-designing these sorts of projects. So it's really like a partnership with the hospital. And I think this partnership is very valuable. So what do you do exactly? What's the nitty-gritty? What are the details? So depending on the skills you have, different opportunities are available, or perhaps you can gain new skills in research, planning, design, and implementation. So you can work on or participate in clinical trials. You can design patient-centered research. You can publish research papers. You can advise on the delivery of a new program, and so much more. The communication side, the technical side of it, well, you can perhaps write policy papers, review documents, be a spokesperson, do some community outreach, and write grant applications, if that's your thing, of course. If you like to take on a more sort of like a leadership role, well, perhaps you can sit on or chair decision-making boards and committees, like the patient board of a hospital, public health boards of a city, or get a seat at an institution. And we'll give a further example of how a certain cancer patient advisor was able to take this opportunity to sit on a very important decision-making board. Otherwise, you can offer basically your perspective on anything related to health, healthcare, and patients because it affects everyone from the patients to the clinicians to hospital goers in general. And finally, in the end, well, being a patient advisor is in itself taking on leadership role if you choose to engage fellow patient advisors in the projects you want to create. So my specific experience as an advisor was on the OR Black Box project at the Ottawa Hospital. On the right side is just their project team, which is a fantastic team, and I love them very much. And on the left side, this image will come back, but essentially we brainstorm a few ideas for posters and pamphlets that we can show around the hospital. So what is the OR Black Box project? That is a great question. Well, the OR Black Box project is essentially a black box like inside of an airplane. It records audio, video, patient vital signs, and environmental data, which is then used for research purposes. And the data is, of course, analyzed to improve medical practice, patient health outcomes, and interdisciplinary communication. Right now, an OR black box is currently being installed at one of the operating theaters at the Ottawa Hospital. So my concrete role as a patient advisor in this sort of project was to consult on the entire project from A to Z. The project is not yet done, but I've at least had to contribute in the beginning, which was to help write the research grant and help write a research paper associated with said project. We've also had to develop patient-oriented internal and external communications, and to do this, we had to collaborate with many stakeholders to create a media or communications plan. And eventually, when our media pitch comes out, I will have to become a spokesperson and be the face for patients for this specific project. Also, my and the other roles of patient advisors on this project was to figure out solution to challenges or concerns that affected patients. So we had questions like, what about patient privacy and confidentiality? How's that being protected? Where can patients get more info? What are the benefits to patients? What are the risks? So these are questions the project organizers weren't aware of, and these were concerns patients had brought up, and should they not have had consulted patients, they would not have known about these questions and concerns. And now, because we did raise these issues, then they can be addressed ahead of time and just improves the overall quality of the project that we're doing. So how are we exactly engaged in this sort of project? Well, like I said in the beginning, there was like a call to action. I had met Claudia and she introduced me to the project team and I went on board. So on this project, we had face-to-face meetings, which personally I believed increased productivity and helped build many relationships within the hospital. And we were regularly kept up to date with the project developments. And for myself personally, I believe that being kept up to date and being in the loop and informed was a very vital part of my engagement in this. It made me feel very included and welcome in the group. Barriers were also reduced. Let's say I needed parking or transportation covered. No worries, that was covered. Every time we had a meeting, we had meals and snacks that were provided because our brains were working and we needed some food to get the brains working. And also, when possible, meeting times were accommodated for the patient advisors. So, of course, researchers and project organizers have busy schedules, but because our time was valued and prioritized, it made our contributions feel much more valued, and it showed that the hospital took our insights and knowledge seriously. As a segue to that, well, our opinions and ideas were considered legitimate and taken seriously, despite perhaps not having the academic or professional background needed for some extensive research and project design. We were also rewarded with personal satisfaction. I personally loved contributing to this sort of project. And we also had the opportunity to have potential co-authorships on research papers. And that not only builds, the research within the hospital, but research within the scientific community in general, and can help build your resume if you're into research. And finally, my most favorite thing about this project is that our impacts were concrete, material, and real. And I'll show you what I mean by that. So remember this slide? Well, we just saw it a few slides ago. Essentially, this image was like a brainstorming that we did for pamphlets and posters. Well, this became this. If you were here in this room right now, in my office, I would be able to give you this pamphlet in person. You'd be able to feel it, touch it, eat it, although I don't recommend you eat it, but you'd be able to do that if you wanted to, because it's real now. It's a real thing that happened, and that was the result of a collaboration between many stakeholders. As much as it was a project, developed by researchers and communications experts, the contributions of patient advisors is what you see on this pamphlet. And for me, that is incredibly valuable. It makes me very proud to have been a patient advisor, at least on this project, because I now know that the patients going through surgery will be able to touch and feel and see this product. They can also touch and feel and see this poster, which is now strewn out and about the hospital, because we've all worked together to come up with a solution that is tailored for the needs of patients. And personally, like I said before, I'll say it again, but this was probably the most rewarding part of my experience as a patient advisor, and I highly recommend people to get involved with sort of project. It's incredibly rewarding. Now, unfortunately, today we couldn't have patient advisors with specific cancer experience be on the panel, but I did talk to them. I did get to interview them, and they wanted to share some of their experiences. So, Susan, as a patient advisor at the Regional Cancer Center, they shared that they have sat on an interview panel for a senior leadership position within the Regional Cancer Center. So, this really shows that if you engage patients, they know what to look for in the sorts of people they want to run their care. Of course, because it's by and for patients. They have also been asked to help with staff orientation. They have sat on a committee that plans or to plan a new patient and family resource center. They contributed to a working group to reorganize a chemotherapy teaching module, and they have been a member of an advisory committee that was asked to review new and/or revised documents, instructions, and general information for clear language and target audience sensitivity. So thank you very much, Susan, for sharing your experience. And sorry you couldn't be here today. I'm sure next time you'll be able to join us. But for now, thank you very much for your contributions. Sometimes the spectrum, or the divide between advisor and advocate, could be a little bit difficult to make. And it gets very easy to become passionate about what you're working on and take on an advocacy role when in fact you should be advising. And it's okay to make mistakes, but just remember the difference and know what your role is. A fellow patient advisor, they shared this testimonial. They said that one day during an advisor's meeting, I got really passionate about palliative care, especially for patients with cancer. I forgot about my role as an advisor and I started to advocate for something better. But I remember leaving that meeting telling myself that I had crossed a line. So it's very easy to, conflict both and to cross and sort of do both at the same time. But just remember, if you're there as an advisor, try to leave the advocacy piece at a different time and different place. There's a time and place for everything. If you're there as an advisor, be there as an advisor. If you're there as an advocate, be there as an advocate. But again, like I said, it's okay to make mistakes. And it gets very easy to make mistakes or to get passionate about things when we're talking about our own health and healthcare. So, finally, we're getting into the implications part of the panel or this topic. What is patient-oriented research? What does it mean for research to have patients involved? Well, patient-oriented research refers to a continuum of research that engages patients as partners, as we've talked about before. It focuses on patient-identified priorities and improves patient outcomes. This research, which is conducted by multidisciplinary teams in partnership with relevant stakeholders, aims to apply the knowledge generated to improve healthcare systems and practices. It also brings patients to the center of focus and engages all stakeholders, which is a really cool way to do research. What does it mean exactly? Well, in 2011, the Canadian government created the Strategy for Patient-Oriented Research, which is called SPORE, which launched in 2014. Despite that, less than 1% of published clinical trials contain critical information on how patients were engaged in the research. Researchers found that, well, the reason that is because there was little to no reporting on patient engagement in research, and there was little to no guidance for researchers to do this sorts of reporting. So what does it mean? Well, first and foremost, we need to start reporting. And if you don't know how to do that and you're a researcher, don't worry. There are dedicated resources to help you. And I will show you at the end the dedicated resource slide that you can check out. So okay, we know that we should do patient-oriented research, but what is the importance of that? Well, the importance is that you get better quality research, of course. You get improved health outcomes. You have an enhanced patient experience with the health system. You have an expanded applicability of the research. And you have the increased translation and disseminations to patient communities. And essentially, when you engage patients in this sort of research, after the advisory role, they can take on an advocate role, which basically accelerates the uptake of new practices if that's what your research was focused on. Moving on, what are the implications for healthcare? Well, why should healthcare feature more patient engagement? That's an excellent question. I wholeheartedly believe that it should indeed feature more patient engagement. Well, because patients offer important perspectives and insights on projects that perhaps clinicians or researchers or hospital staff might not have known about. Just like on the OR Black Box project, we raised a few questions that the researchers didn't know, and because we raised those questions and those issues, now they can be resolved. And just de facto, when you do that, it instills a sense of trust and confidence from the public, which indeed overall improves healthcare quality. And again, by default, if you improve healthcare quality, you improve the patient experience. Based on all of this, well, you have the potential to get it right the first time, it being referred to different projects or research or programs you want to implement. You get to get it right. There's also reduced administrative and systemic costs overall. There's an improved safety, and essentially this is what this project was all about. The Aura Black Box project aimed to improve patient safety and improve patient health outcomes. Um, and just by this fact, patients want to be partners and benefit personally from gaining knowledge and supporting their community hospitals. So this is a very big empowerment piece for patients when they get involved with healthcare, which overall increases satisfaction, and of course, due to the social determinants of health, uh, makes it so that patients are overall healthier when they get involved. It's also important because, well, pan-Canadian hospitals are facing difficult choices about their healthcare priorities, especially now with the generation gap. We see more folks in geriatric age outnumber young folk. So hospitals have to make these difficult choices and have to make these priorities. And how you inform these priorities is by engaging patients. Your patients are essentially clients. That's how hospitals could know where to direct resources. And finally, the public. Well, because the public is the main funder and user of healthcare, therefore, like I said before, patients become empowered when they get involved in their healthcare. What's in it for patients? I've talked a lot about what's in it for healthcare and a lot about what's in it for research. But for patients on a personal level, what does it mean? Why is it important? Well, it's extremely valuable work and practical experience in a healthcare or research setting, if that's what you want to do. It builds communities and your resume all at the same time. It provides an unmatched sense of pride and satisfaction, and you can concretely contribute to the improvement of our healthcare and healthcare systems. You can also have legitimate input on research design and helping generate better health outcomes. And you have the opportunity to develop new or not skills and expand your professional network. And in the end, of course, if you choose to get involved with the research piece, well, it contributes to research literature. And I think personally, the most important part of of this webinar is that the fact that patients get involved, they advise and advocate, it means that it helps patients gain control and ownership of their health. And that is the most powerful tool you can give back to somebody. Because when you let people gain control and ownership of their health, it gives them a sense of agency, pride, and of course control, which ultimately improves people's health outcomes. Now, if you want additional resources, here are additional resources. You can check out, if you simply go to Google, the Institute for Patient and Family Centered Care, the Canadian Foundation for Healthcare Improvement, Health Quality Ontario, Cancer Care Ontario, the Canadian Institutes of Health Research, World Health Organization, Canadian Patient Safety Institute, the Patient Centered Outcomes Research Institute, the Involve project in the UK, and the Strategy for Patient Oriented Research, or SPORE, as I've mentioned it before, in the Ontario. You can just consult SPORE essentially. In Ontario, if you're in Ontario, you can have the support of the Ontario Strategy for Patient Oriented Research Support Unit, so the OSSU. And that's, again, if you need some help doing some patient engagement in the research context, then that is how. Then those are resources you can consult. Now, here is the Canadian Cancer Survivor Network's contact info. They are located at 1750 Goldwood Crescent in their email. You can contact them right there. Hopefully, I leave this long enough. Before I conclude, Claudia, is there anything you wanted to add to the presentation?
Just that you did a great job, Max. I think you covered everything.
Thank you very much. Well, this is this slide. Finally, I just want to say that we must be relentless in the pursuit of better, because there is always going to be better. So thank you very much for attending today's webinar. It's a bit short, I know, but hopefully the Q&A will help out with that. I wanted to give a special thanks to Claudia, Zara, Sandy, Antoine, Lori, Aya, Nicole, Susan, and Adnan at the Ottawa Hospital, and special thanks to Mona and Allison at the Canadian Cancer Survivor Network. If you'd like to contact me directly, and I invite you to do so because I love meeting people, well, here's my contact info. My name is Maxime Lê. That's a picture of me. You've probably seen it in the advertisements for this webinar, but my cell phone number is 819-431-8600. My email is my University of Ottawa email. It is the mle094@uottawa.ca. And if you want to learn more about me and what I've done in the past, or what I'm currently working on, please feel free to visit my website at www.maximele.com. Once again, a francophone version of this presentation is available in French upon request, so please simply contact me. Juste pour le rappeler, une version francophone de cette présentation est aussi disponible sur demande, donc n'hésitez pas à me contacter pour l'obtenir. And I just want to conclude by saying, if you want me to come out and speak to your group or whatnot, please. I'm always welcome invitations to do so, because I love meeting people, I love working with groups, and I love what I've done today. Thank you again to the CCSN for inviting me. Now I believe Allison will facilitate the Q&A.
Yes, thank you again, Max. That was fantastic. So just a reminder to everyone, now is the Q&A period. You have a question panel. It should be on your dashboard to your right. If you have a question for Max or for Claudia, please feel free to type it in there now, and I'll send the questions forward to Max. I believe I've sent you two thus far, Max, that you can have a look at, and you and Claudia can address.
Yeah. So, somebody asked, what does PFAC stand for? I believe, Claudia, you're best suited to answer this question.
So that's the Patient and Family Advisory Council, or sometimes committee, depending on the organization that you're in. These are groups of patient advisors that come together in a particular area, or for us, we also have a corporate and a cancer PFAC. So this is called the Patient and Family Advisory Council or Committee.
Thank you very much. Next question. Acknowledging that certain illnesses or diagnoses proportionately affect marginalized populations, what are your experiences with procuring anti-oppressive and cultural competency training for staff before engaging patients? Well, that is a very good question. Unfortunately, I have not had the chance to deliver this sort of content or work with this kind of content, but I do know that there is a big network of professionals that are ready to deliver this sort of anti-oppressive or cultural competency training. But something patient advisors can do when taking on a leadership role is to perhaps create a multicultural or intersectional committee that would sort of you know review the kind of information that is given or the kind of training that is given to staff. So that would be perhaps a project a patient advisor could undertake. And you know what? Hey, after this presentation, I might just work on that right away. So thank you very much for the suggestion. But yes, it would be to develop a intersectional, multicultural panel of or council of patient advisors to come up with trainings that are appropriate for staff, which will teach cultural sensitivity, especially towards marginalized populations, because I know that is a big issue. In my undergrad, I have studied this extensively. So I hope it answers your question. Thank you very much for the suggestion. I think we'll do that. I don't know if Claudia, do you know if anybody has done this at TOH?
Yeah, we do have some specific training, not so much for our advisor program. Right now, our advisor program, the orientation is in development. We are co-designing the program with patient advisors. And I agree with Max, this is a fantastic comment and idea for us to take back to our group. We're looking at piloting our advisor orientation program in January. We're working on it together with advisors now. So the timing is great to get ideas like this. If there are any more, please don't hesitate to send them to me or let Max know.
Yeah, absolutely. Next question, and thank you again for the questions. They keep coming in. It's fantastic to see this level of engagement. Here we go. So the ORBB interests me. The OR Black Box Project interests me. So what are the expected outcomes with that research? How many hospitals are involved? Well, I'll just go back to the slide here. I just first of all like to let you know that if you would like some more information, concrete information on the ORBB, you can always contact the research team at medresearch@ohri.ca. Just it's what you see below there, or you can call in for more info at 613-761-4775. But essentially, from what I've been able to understand and learn about this project, the expected outcomes for this is that we would see an improvement in interdisciplinary communication, which ultimately would improve patient safety and health outcomes post-operatively. So after people have had their surgery, perhaps we could see a reduction in surgical mistakes, or an increase in just overall general health. Yeah, that's sort of like the expected outcomes of this project. How many hospitals are involved? I believe TOH is, I think, the second, I believe, hospital in Canada to have this. It was piloted in Toronto several years ago and now has expanded worldwide. So if it is not the second in Canada, then I believe it is like the fourth in the world. But of course, if you like some concrete information, fortunately, I don't have that slide with me today to provide that. But indeed, it is one of the very novel things that is happening in the realm of surgery. And thank you very much for your question. I'm glad that you are excited about this. I was too, obviously. Next question. So it says, "Hi Maxime, thank you for your great presentation." Well, thank you very much for your kind comment. I know that both advocacy and advisory are important, but what would you think is more important in terms of policy change in the healthcare center in a bigger scale? Well, of course, in the bigger scale, it all comes down to policy, because policy is how it affects procedures and what is permissible or not in a hospital or healthcare setting. So of course, advocacy and advisory, I believe, is personally equally as important, because you cannot have one without the other. and I know there's a distinction to be made, and I hope I made the distinction clear, but both contribute to improving healthcare in their distinct way. So advocates can, they create petitions, they can get involved with groups and go towards their governments and sort of like lobby the stakeholders necessary to get the change they want to see. But in order to do that, you also need patient advisors that work on the ground in the technical to figure out how to implement the changes that the advocates want to see. So even though advocates are the ones that are going to be more on the policy change part of the equation, those that are advocates actually create the make the changes that the policies want to change. So in a bigger scale, I'd say it is the advocate piece, but again, advisors and advocate both play a huge role in improving and changing the way healthcare is made, if not across Canada, well, across the world. All
And I
right.
think, Max, as the advisor role in hospitals takes hold and increases, we'll hopefully see faster and better improvements in the hospital system.
Absolutely. Now, next question. I'm on the West Coast, so hello West Side. In private image settings, do you have any insights or experience with private healthcare advocacy or advisory groups and a contact over on this end of the country? Well, you know what? I am fortunate enough to have a pretty good network of at least young professionals that are across Canada. So I'd be more than happy, if you just send me an email to reach out to my network and see if they know anybody in that sector. Unfortunately, I have not done much work in the private healthcare group in the West End of the country, but I'm more than happy to help you out with that inquiry because I'd be much interested in that as well. Perhaps Claudia, you have some folks that know where to know this.
I'm sorry, I don't have any contacts out west.
There you go. But just send me an email, and I'll just I'll just put up the slide again. Send me an email send me an email and we'll get in touch and we'll help each other out. I'm sure we can find somebody that can help you out. So, are there any more questions, comments, compliments, insults?
No more questions here, Max. A couple of thank you for the great presentations, which I wholeheartedly agree with. It was great. It covered a lot of ground. And again, as Max said, please feel free to contact him if you have any other questions or any other, if you just want to chat with him about patient advisory. He's a great resource. We can vouch for that. So thanks again, Max. And with that, we will conclude